Hello, Mr. Steele.
Hello.
My name's Jennifer Steele.
Hi.
I'm a nurse practitioner student, and I'm going to be doing your exam today.
Okay.
But first we're going to go over just some basic health questions that I'll ask of you. And was there any other concerns that you wanted to bring up with your wellness exam that you have going on today?
I would like to talk about my smoking.
Okay. How long have you been smoking for?
A long time.
Okay, so we'll make sure that we address that concern today, okay?
Okay.
So how about first we start with just a past medical history about yourself. Have you had any hospitalizations or surgeries?
I did have a surgery on my leg. I broke it at one time.
Okay, which leg was it?
My right leg.
Okay, and what happened?
I had a piece of equipment basically fall on top of it.
Okay, do you remember what bone you broke?
It was my femur.
Okay, and how long ago was that?
I think it was in 2002 or 2001.
Okay. And any problems since then with it?
No.
Good. And how about any major childhood illnesses such as measles, mumps, chickenpox, pertussis, scarlet fever, rheumatic fever?
I had chickenpox when I was probably about 2 weeks old.
Okay.
So.
Okay. Any history of tuberculosis, hepatitis, diabetes, high blood pressure, or any heart disorders?
No, nothing like that.
Are you current on your immunizations?
Yes.
Okay. Did you receive your flu shot this year?
No, I didn't.
No. And where did you get your immunizations done? Because I don't have a history in here since this is the first time we've seen you.
Just at the local health department.
Okay. And we should be able to get those records too from them. What medications do you currently take, and include any herbal medications as well?
None.
None. And how about any allergies to medications or foods?
I am allergic to cats.
Okay.
As far as I know, that's the only thing.
And what happens with cats?
I just get really scratchy. Stuffed up, my eyes get red.
Okay.
So.
Do you develop a rational?
If I'm around them long enough.
Okay. And how would you describe your overall mood?
Good.
Good. And how's sleep? Your sleep patterns?
Actually, I sleep pretty good.
Okay. So how many hours a night would you say is a good night?
Not a ton, like 5, 6 hours,
okay.
maybe. So.
But that feels like enough for you.
Yeah.
Okay. And let's go ahead and talk about significant family history. So talking about your parents, are they both currently alive?
Yes.
Okay. And significant history for them would include like heart disease, diabetes, stuff like that. So on with your mother, is there any history of heart disease, diabetes, high blood pressure, stroke, asthma, or any blood disorders?
No.
And how about with your father? Any history of heart disease, diabetes, cancers?
No, nothing like that.
So when talking about your grandparents on your mother's side, same kinds of history, but are they both alive currently?
Yep.
Okay. Do you know how old they are?
Oh, grandparents?
Yeah.
I know my grandpa is in his early 90s. My grandma is in her later 80s. I couldn't tell you the exact age, but...
Significant history that you're aware of with them? Heart disease, high blood pressure, diabetes?
No,
stroke.
They're actually both really healthy.
Good. How about grandparents on your father's side? Heart disease, diabetes, cancers?
My grandfather, he did pass away a couple of years ago. He had a stroke. He was a diabetic. My grandmother is also a diabetic. She's still alive.
Okay.
Yeah.
Okay. So those are the only ones that you are aware of for their history?
Yeah.
Okay. And do you drink alcohol?
Yes.
How often?
A couple times a week.
Okay. So a couple times, 2 to 3 times a week, would you say that is?
Yeah, that's probably.
And how many drinks do you have during that time?
2 or 3.
And you mentioned tobacco use.
Yes.
what kind of tobacco do you use?
Cigarettes.
No chewing tobacco, cigars?
No.
And when did you start smoking?
I was 15.
So about 18 years, it looks like. So that puts you right around 9 pack years.
Mm-hmm.
If you were doing, you were saying earlier, how much were you smoking? 1 pack, or was it?
About half a pack.
Half a pack,
which
okay,
is
so it is 9.
basically like 10 cigarettes.
Okay. And we will talk about ways to help quit smoking and resources for you, for sure, at your exam today.
Okay.
And how about any drug use?
No.
And do you have a specific religion that you'd like me to take note of?
No.
And what is your occupation?
I work as a welder fitter.
Okay. Do you do that locally around here?
Yes.
Where do you work at?
I work at a company called Nomad Global Communications.
And what do they do?
We basically build custom trailers, custom anything for any type of U.S. government agency.
Okay, that sounds interesting. How about occupational exposures with your job with welding?
We have, obviously we have smoke, dust, anything like that. Nothing more than any normal welder would have.
Okay, which that would be also gases? Or,
Yes.
Okay. Do you have your personal protective equipment that's available and you use it?
Yep.
Good.
They're supplied to us.
Good. And how about exercise?
Not as much as I should.
Okay. Life gets busy, I know.
I know, it's tough.
Describe your typical diet to me. So on a regular day, what would you say are the foods that you usually eat?
Let's say like a lot of like meat, salad, stuff like that. I don't eat a lot of fruit. I don't eat a whole lot of like breads, sweets, anything like that.
Okay,
Just
so
like
mostly lots of meats and vegetables.
Yeah.
Okay. And are you married?
Yes, I am.
How many years?
13.
13. And do you guys have any children together?
We have 2.
2, and how old are they?
We have an 8-year-old and a 6-year-old.
Okay. Boy, girl, 2 girls, 1 boy, 2 boys?
The 8-year-old is a girl.
Okay.
The 6-year-old is a boy.
Okay. And plans of any more children?
I think we're pretty solid with what we
Pretty
have.
solid? Okay. And do you guys have measures in place to prevent pregnancy?
Yes.
Okay. And any history of sexually transmitted diseases or concerns about possible exposure to sexually transmitted diseases? Is there any other concerns that you wanted to bring up today for your wellness exam that you're here for?
No, I think that was about it.
All right, well that's all the questions that I have, Mr. Steele. I'll let you go ahead and slip into a gown, and I'll be back in and we'll go over the exam.
Okay.
All right, thank you.